Hi friends, you've probably heard that South Korea has had a significant outbreak recently, and I just wanted to give you an update and let you know what was going on. Basically, there was a 29-year-old male who lives in a city called Yongin. On May 2nd, he had fever and diarrhea, and despite these symptoms, he decided to go out with his friends and go clubbing in a neighborhood called Itaewon in Seoul, our capital city. Over the course of the evening into the wee hours, 4:35 in the morning, he and his friends visited 4 to 5 clubs in that area. He continued to feel poorly over the next few days. On May 5th, he received testing for COVID-19. On May 6th, he was diagnosed, and because of the discovery of this patient, the tracking and tracing and the epidemiological survey has shown that the period between April 24th and May 6th, anyone who has been to any club in the Itaewon area may have been exposed to COVID-19. And so thousands of people may have been exposed. We have since tested 22,000 people who have come forth to be tested, and 119 have come back positive. Of the 119, 76 people were actually at the clubs, and 43 are secondary transmission cases, including, unfortunately, the 84-year-old grandmother of one of the club goers, the 1-year-old nephew of one of the club goers, and the 11 students of one of the club goers who happens to be a hagwon or study academy teacher. The 11 students were all middle and high school students, less than 19 years old. And today was supposed to be the first day of school in Korea for high school seniors. The academic school year was supposed to start March 2nd. And of course, because of COVID-19, it was postponed, and then school started online, and today was supposed to be the first day of in-class learning. You can only imagine what type of catastrophe we could have had if those 11 students had actually gone to school, because 35% of the 119 people who have been tested positive actually have no symptoms at all. But we know already that people are highly contagious very early on, even if they don't have symptoms. So yes, the opening of schools has been postponed. All nightlife venues, bars, clubs, discotheques, room salons, they have all been closed, shut down indefinitely. And so now we are, of course, rethinking our strategy towards reopening Korea's businesses, and what sort of measures are practical, what sort of measures are safe. Our primary goal has always been to prevent death due to COVID-19, and so we are very careful to now protect even more vigilantly our vulnerable populations, our elderly and people with chronic diseases. Our next goal is to stamp out or to suppress COVID-19 in our country. And I think this outbreak is showing us what we suspected, what we already knew, that COVID-19 is not going to disappear anytime soon. It is going to stay with us for many months. And so we are going to have to learn how to manage our lives, manage our economies with COVID-19 in our midst. And this leads to, of course, infectious disease prevention measures that need to be practiced by everybody, every day, all the time. And the young adults of Korea, aged between 20 and 40, they make up the largest group of COVID-19 patients. 40% of all COVID-19 patients fall in this age category. We are depending on them to do the right thing, and to practice a lifestyle that actively prevents infection. We have about 19,600 test results still pending. And so I suspect over the next few days, we will have more positive cases as part of this cluster. The fear is that there will be people who have been exposed, who have gotten COVID-19, but who do not have symptoms, feel well, and are now active in society and actively spreading COVID-19 unknowingly. And so we are urging everyone and anyone who has been to a club in the Itaewon area between April 24th and May 6th to please get tested regardless of whether you have symptoms or not. The testing is anonymous and the testing is free. And this outbreak is showing us the importance of having a very robust public health epidemiology system in place when you open up your society, because outbreaks like this are inevitable. They will happen, and in order to prevent them from exploding into tsunamis, you really need to be aggressive with your testing, tracking, tracing, and isolation. So I will update you guys, as best as I can, because this is a rapidly evolving situation. Hopefully we will be able to get this under control soon, and we will be able to modify our approach to COVID-19 so that these kinds of outbreaks are prevented, ideally, but if they happen, that we can get control of them quickly and limit the scale of their impact. So, conclusion, I always say, from the beginning, I've always said, wash your hands, wash your hands, wash your hands. That is still the most important thing to do. Hand hygiene, respiratory hygiene, stay home if you don't feel well. And in terms of businesses and indoor spaces, make sure that you're cleaning, disinfecting, and ventilating, and keep your 2 meter or 6 feet physical distance from people as much as you can. This is the new normal. This is how we need to live until a vaccine is manufactured en masse for everyone on the planet. It's going to take a long time for that to happen. So we should get into the habit of practicing these infectious disease prevention measures in everyday life. I hope you stay well, and please stay tuned for more updates. Thank you.